We did use what we call Healthy Kansas 2020, and that's based on the National Healthy People 2020 document. And so it's strictly for Kansas. It's really the state's roadmap into improving health of our communities within the state. And so we use that as our guideline to make sure that our community health improvement plans, strategies were representative of what the state was looking for as far as how we can improve our health.
Healthy People 2020 was used throughout the process for us. So from the very beginning, once we'd finished our community health assessment, actually within our community health assessment document, we show the Healthy People 2020 goals. And that allows us to see where we're at. It helped us choose our priority areas to really say, where are we doing good? Where are we not doing good? And Healthy People 2020 helped us determine that. And then once we had chosen priorities and we were actually looking at implementation strategies, we wanted to set some goals for ourselves of where we should be and where we want to be in 2014, 2017, 2020. And that's where we came up with a lot of our goals, was from Healthy People 2020. In some cases, we just took the Healthy People 2020 goal and said, we're going to be there and we're going to meet it. In some cases, we didn't feel like it was necessarily realistic for us to meet it, but it helped push us forward and helped us choose a realistic goal for our community.
Healthy People 2020, Healthy People 2010 was used. We also used the baseline mainly for Healthy People 2010. We haven't became as astute to Healthy People 2020 and looking at those measures because we wanted to make sure we meet the benchmarks in 2010 and build upon that. There was some data, I would say, that we are still exploring. We did look at county health rankings because that was an important piece and really looking at health behaviors and social determinants of health. So when we really begin to drill down and draw the information out, we saw that there was issues with infant mortality in the African American community, Hispanic community. We saw that there was issues with binge drinking. We saw that we need to expand more parks and trails. Even though we have done an excellent job, we still can bring that more to the forefront and build more of a built environment up so people can exercise.
And I will say, too, that in our alignment document, we did align with national standards as well as Healthy People 2020. So even though our assessment was originally built on the 2010 objectives because of the time frame, 2020 wasn't built yet, we did align with 2020 so that we can move in that direction.
And also, we did look at the national prevention strategy as well. So that was taken into consideration in terms of moving forward with our strategy.
Well, we started our CHA-CHIP process in 2008, so at that time we were using Healthy People 2010, of course, but we really did. I would say we used that more in the CHIP process after our CHA, to set those aim statements and our goals, to have something measurable, and that was a really good jumping off point for us. And of course, our Kentucky Department for Public Health puts out the Healthy Kentuckians 2010 or 2020, and so that was able to give us some really good goals instead of us just trying to guess, out of thin air, should we reduce it by 5% or 10%? It really gave us something to go by.
We did use Healthy People 2020 primarily in three ways. Our epidemiology staff used Healthy People 2020 to develop two comprehensive health status documents that we published back in the fall of 2010. How Healthy Are We Cobb and How Healthy Are We Douglas. Our MAP steering committees both referenced Healthy People 2020 multiple times during the assessment process, and particularly near the end when they were choosing strategic priorities. And finally, Healthy People 2020 standards will serve as benchmarks for many of our metrics in our community balance scorecard.